Start with the first full day of the Donald Trump administration, and California is already being impacted. One of his executive orders demands agencies sending more water from the Sacramento-San Joaquin Delta down to Southern California.
The Trump administration argues the plan helps an area that desperately needs a reliable water supply. Critics say it endangers certain kinds of fish, like the Delta smelt, Chinook salmon, and steelhead trout. You may remember California sued the first Trump administration to stop the plan. Making good on his promises, President Donald Trump introduced a laundry list of executive orders on his first day in office.
That includes repealing Biden's executive order that lowered prescription drug costs for Americans. ABC 10's Devin Truby has a closer look at the impact.
We spoke with local pharmacists today about how this is going to impact their future, from being able to address patient concerns to how this is going to impact their prescriptions. There's still a lot of moving parts. Hidden in the headlines of President Trump's massive executive order release is something that will potentially impact more than 6 million Californians on Medicare.
I was shocked.
Repealing Biden's executive order 14087 from October 14, 2022, called lower prescription drug costs for Americans. The order was working on three things: having Medicare prescription plans offer generics for $2 copays, improve access to cell and gene therapy, often used to treat things like cancer, to Medicaid recipients, and third, speed up the process for access to effective new treatments.
Scrambling to understand what's going on and how are we as pharmacists going to be able to provide education to our patients and our physicians to allow patients to still have access to these medications at the lowest possible price.
Still on Trump's chopping block is the Inflation Reduction Act. He ordered federal agencies to stop spending money on it. According to the Centers for Medicare and Medicaid Services, in 2025, lower prices for some of the most expensive and most used medications would go into effect, and they were set to negotiate on 15 more big-name drugs.
Ozempic was one of them. The Breo, which is an inhaler used to help patients control their asthma or COPD. Linzess, which is another medication, not generic. It's used to help patients with GI issues. So these are some of the medications that we see very frequently, very common.
The Inflation Reduction Act also capped out-of-pocket expenses for Medicaid at $2,000 and insulin at $35 a month. Most patients had yet to get the benefits from Biden's executive order. However, for local pharmacists like 10 Acres and Poochie's, there was concern about how this was going to affect them.
There were some problems with the proposal that pharmacies were going to have to carry the cost of those drugs that were going to be rebated. And for independent pharmacies like ours, it could be as much as $27,000 per month on average.
Both 10 Acres and Poochie's agree the fallout from this could be access issues.
Some of these medications are super expensive for even us to purchase, and the reimbursement from the pharmacy benefit managers tend to be below some of our costs associated with this. And so we've had to steer patients to go through mail order or to go to some of the big box chains to get their medications filled.
Especially with big box store pharmacies like Walgreens recently announcing closures. Reporting in Sacramento, Devin Truby, ABC 10.